back from a world tour of London, Rome, LA, and now back in the good old New York. Introducing the Sea Rappers and their entourage, DJ Cumras, Professor Liz. Are we gonna move your ass? Well, ladies and gentlemen, what's up? Put your hands up. Put your hands up. I got a little joke for y'all. What's a pirate's favorite antihypertensive medication? ARBs, that's right, ARBs. That's what we're going to teach you all about today. Angiotensin 2 receptor blockers, aka ARB.
Yeah, woo!
DJ Comrades, turn up that groove. Gonna move my ass. What you gonna do? What you gonna do? Put it louder, put it louder. So your patient is suffering from hypertension. PCP, listen to me, you better pay attention. People in the back, stop that crap. I know y'all all ain't listening to Paul, looking at the screen. You know what I mean, you're on the net, I'm willing to bet. Diabetes, heart failure, stroke prevention, migraines, MI, and hypertension. Therapeutic uses, there's a whole lot more than what I told y'all before. Professor Liz, say what it is.
Okay, so very important point in general. ARBs are used in patients who cannot tolerate ACE inhibitors. So keep in mind that ACE inhibitors are preferred, but ARBs are an appropriate second choice if ACE inhibitors are not tolerated. Okay, so as you just heard in Lewis's rhymes, these meds are approved, all are approved for hypertension, and they have other cardiac indications, as you can see, such as MI, heart failure, and stroke prevention. Some non-cardiac indications to keep in mind are diabetic nephropathy. Currently, 2 ARBs are approved for the treatment of diabetic nephropathy. That's irbesartan and lorcaserin. Okay, let's take it away. All right.
Turn it up.
Yeah.
So you heard from me, I'm one of 3. Let's give it to the Dario. What's the scenario?
Woo! Angiotensin 2 receptor on the cell when activated, then the pressure starts to swell. Pressure starts to climb, all be fine. ARB has high affinity. When we lock it, then we stop it.
Okay, thank you to Dario. So, just to summarize, angiotensin 2 receptor blockers have a high affinity for the angiotensin 2 type 1 receptors. These are located on blood vessels, the kidneys, the heart, and adrenals. Just to name a few places, you can see the other ones up here. So when these drugs block these receptors, they cause the opposite of what angiotensin 2 does. So therefore they cause vasodilation and they increase renal excretion of sodium and water, just to name a few, and all those contribute to decreasing blood pressure. And a key thing to keep in point is that they have no effects on bradykinin metabolism, so therefore they don't contribute to cough like ACE inhibitors do. All right?
Back to me. Gotta wait for the beat. There are 7 of these fellas that exist. Look behind me, you will notice the list. Ladies and gentlemen, I beg your pardon, but did you notice that all these drugs end in sartan?
Okay, just to summarize again, there are 7 ARBs in this class. They're all very similar. As mentioned, they're all end in sartan, so that's easy to remember. Good test question. Losartan is the prototype for this drug, and its trade name is Cozar. Go.
Yo, Anu, you know what to do. Get all these folks up to groove with you.
Yeah.
Blink, blink,
All right. Take it from me that generally, ARBs will accept or accept
for these 3. And one more thing, you don't take these drugs during pregnancy. Your kids will get harmed before infancy.
Alright, thank you, Anu. So overall, ARBs are generally well tolerated. Its main adverse effect is hypotension, just like all other antihypertensive agents. Like ACE inhibitors, ARBs can cause angioedema, but the incidence is generally lower with this drug. You should caution when you're prescribing this medication to patients who are at risk of hyperkalemia or renal failure, since these drugs can exacerbate these conditions. And as Anu pointed out, don't give during pregnancy if you want to cause harm in infancy. These have been shown to cause harm to the fetus in the 2nd or 3rd trimester.
All right, next up. P.O. There's lots to know. Once a day, twice a day, who cares? Your heart will decay.
Okay, so as you just heard, all ARBs are administered PO, and they can be taken with or without food. All 7 medications are available alone or in combination with HCTZ, which is a thiazide diuretic. So here is a list of all of our drugs and their indications and their dosage for your view and pleasure. All right, so we're going to wrap it up here. Turn it up, comrades. Ready?
Thanks for your time. I hope you liked our ride. Hope you learned a lesson.
Thanks for your attention.